Yeah, Dr. Saravanan, did you say a COVID patient passed away last night?
Yes, Mitch.
Okay, so the total is at 2 right now for Ector County.
Yes.
Could you just tell us their age and if there were any underlying conditions and their gender?
Yes, they were in their 60s, 70s. It was a female.
Okay. And no underlying conditions or
Oh, plenty of underlying medical conditions. You'll find that as time goes by, you'll see how this distributes out. People with underlying medical conditions are at much higher risk than others. And so that's what you'll find. Even the person that recovered in the hospital, their lungs started off being better than someone else who passed away, and which is why they recovered. So all those will play a factor, most definitely, as this disease progresses.
Thank you, doctor. And I guess, Brandy, you know, the current death count on the Ector County Public Health website is 1. And I guess what is the process right now that you guys have in place to update that counter to reflect the accurate numbers?
Based on the information I have, the resident that was at Ormc that passed away is not an Ector County resident. So we have contacted the state, the region that we work with, to go over this with them, and it will be numbered in the region, in the county that individual resides in. So it's not an Ector County resident, even though they did pass away in Ector County.
All right, thank you.
Uh-huh.
I think those are all my questions right now.
Thank you.
All right, Danny, you want to shoot?
I'm good right now.
All right, Mike Merlot.
Yeah, let's see here. During today's press conference with the president, health officials talked about how the surge, isn't as substantial as they thought it would be. Is that something we see as hopeful in the Permian Basin?
Yes, I can take that if you don't mind. Absolutely, Mike. It is, I think our community is heeding advice the best they can, and we want to continue to push them to do that. But the effects of them heeding our advice will be reflected in the numbers that we start to see. So hopefully, yes, I am optimistic that it will not hit us as hard as we are planning for. That's always the hope, and I'm very optimistic for that. Yes.
Okay, and how did the plasma testing come all about? And I guess that would be for MCH then.
Yes, sir. Scott, our lab director and our chief medical officers got together, and our intensivist doctors started working on this a few days ago. I know that Dr. Azaroff there at the hospital, he really started calling the FDA and calling around, and got us a number and got us approved, and we had a patient that qualified for that. And so once that call was made and we got some contracts signed, it was pretty quick to get that plasma from San Antonio to medical center, and it moved pretty fast. So that was just quick thinking on our physicians' parts to be able to put their heads together and get this type of treatment available. It's going to be really interesting to see how that advances the patient's care.
Michael, I can add on a little bit more for you if you like.
Yeah.
The FDA did issue guidance to healthcare providers on the administration of convalescent plasma, which is basically collected from individuals who have recovered from the disease. So I gave you that web address as well. There's 3 separate pathways through which you can get this plasma. One is if you were running clinical trials, or second, if you were participating in someone in an academic institution that was running clinical trials. I don't think either one of our institutions is doing that right now, but the single patient emergency, that's the way in which we can start to apply to the FDA. There's an application process for each specific patient to get that. There's very specific eligibility criteria for these patients that is listed on this website as well. And there's also very specific eligibility criteria for the donor that is also listed on this website. So to put it in very simple terms, patient eligibility criteria is patients that are very, very sick and that have failed many other treatment options. Donor eligibility criteria is people that have had the disease and have recovered from it and have had negative tests for the disease twice after the 2-week period of time, and they've had a test for antibodies, which are protective against this COVID virus. If they have those, then they can donate. Both MCH and us, we use Vitalant as our blood bank, and that blood bank is currently approved to collect the plasma. The labs that we've been using, our private labs, LabCorp and CPL, currently don't have the IgG test available yet. That's the antibody we will be testing for in recovered individuals who could potentially donate. Once that test is also available locally, I think we'll see that there's more people, even from our local community, that'll be able to donate plasma. For now, as MCH has done, we have to reach out outside our area to get the plasma in on a case-by-case basis as needed.